My name is Dr Gowri. I'm a consultant obstetrician and gynaecologist and a fetal medicine consultant here at King's College Hospital in Dubai.
My name is Emma Robertson. I am a UK trained midwife. I'm also a lactation consultant and a hypnobirthing teacher as well. And I've experience of working in the NHS in the UK and also in the private sector in Dubai.
I keep getting asked by women, and this is what women want, is hypnobirthing. Hypnobirthing is something that empowers women and enables women to be able to go through a lot more of a positive experience in labour and delivery. And this is why I was very keen for Emma to join me. Emma is a certified hypnobirth practitioner. Perhaps, Emma, you can discuss a little bit more about what you do and what it all entails.
As Dr Gowri mentioned, I am a qualified hypnobirthing teacher. I trained in the UK and I teach a UK-based course that was designed by a woman called 𝐃𝐮𝐬𝐬𝐿. Hypnobirthing itself is a complete course. It's normally taught over a month long duration, about 12 hours in total, and it focuses on sort of all aspects of maternity care. It's a full comprehensive antenatal education package, and women learn and their husbands learn about labour and delivery, the later stages of pregnancy, as well as learning specific hypnobirthing techniques, which include visualizations, relaxation scripts, and comfort and massages. And basically the whole purpose of hypnobirthing is to reduce fear and anxiety and promote confidence and an excitement towards the upcoming delivery.
It's like having the ability to go through labour, the daunting prospect of labour and the pain to come with a lot more control. Is that a good sort of summary?
Yeah, I mean, the techniques that we use are developed by a hypnotherapist. So a lot of the scripts that you will listen to are hypnotherapy based. And the whole concept is that you learn these techniques and you practice them every single day in labour, so that when the time you actually go into labour, you have trained and you're fully ready and confident to go. You have no anxieties, no worries. And the purpose of the scripts is probably a good idea to explain what that actually does. The scripts you practice every single day, and what it does is it actually works on the subconscious of your brain over time. So in the essence, you're kind of training your brain to relax when it hears this specific recording or this piece of music, whatever you've been given. And you play that throughout your labour and your delivery, and it triggers your body and your brain just to become really calm, collected and relaxed. So the emphasis of hypnobirthing is that there is going to be no pain there to start with, because you have no fear and you have no tension and anxiety. So that's what it's all kind of based around.
You mentioned a little bit about the techniques that are used. This meditation or this...
Yeah, so we do relaxation scripts. So there's several different scripts for different occasions. So there'll be scripts that you will practice every single day to prepare you for labour and birth. If you have a day where you feel particularly anxious or upset, the scripts that you listen to just to calm yourself back down and feel relaxed. We use different breathing techniques. So you have up breathing for different parts of your labour. You have down breathing when you're actually trying to deliver your baby. We focus on sort of positive visualizations and positive affirmations, and it's almost the thought process is that where the mind goes, the body follows, and that's kind of one of the big emphases of it.
So if I were pregnant and I wanted to know, when do I start practicing, or when do I start learning about hypnobirthing? Is it when I get pregnant, or is it a specific time which you would suggest?
So the kind of current recommendations are that you can really adapt sort of hypnobirthing techniques at any point throughout your pregnancy, but I would say, based on experience, the best time to start a hypnobirthing course or to find out more information about it is when you start your second trimester. So once I think the best time is roughly when you've had your 20-week scan. From 20 weeks is a really good time if you're going to start learning about hypnobirthing and taking a course. Because of course, the later that you do leave it, then, as I mentioned previously, you have to have the time in order to train and to practice and to work on the subconscious of your brain. So if you wait until sort of 36 weeks to actually complete the month-long course, then the techniques may not work as efficiently as what they could have if you had taken the course much earlier.
And does it work?
Yep, there's definitely evidence to support it. There's evidence that basically says that women who hypnobirth have used less pain relief methods. They have a much shorter labour. There is some evidence to suggest that less instances of having unplanned caesarean sections. And most women just feel a lot more confident, a lot more at ease, and they don't feel as fearful. So yeah, there's definitely some evidence to support it. Of course, as a midwife, I've looked after many women who have hypnobirthed with me, and to see it in practice is amazing. It's really good.
It is. Can you induce labour by hypnobirthing? Can you start your own labour by hypnobirthing?
I think if you look at the evidence, there wouldn't be much written about that. So you would have to say, in essence, no, you can't induce your labour. But what you can do is, of course, we know that there's certain hormones that are responsible for labour beginning, and one of those is oxytocin. And oxytocin is really, when you feel calm, relaxed, you don't have fear or tension, the oxytocin levels in your body rises and your stress hormone reduces. So, of course, if you're a hypnobirthing mum and you generally have practiced throughout your pregnancy feeling relaxed and calm, you are probably more likely to go into spontaneous labour than being induced, because of the nature of, that you do feel relaxed and you do feel calm. So, of course, that affects your hormone levels.
And do women that use hypnobirth, do they need less pain relief overall? Is there any evidence for them needing less painkillers in labour and delivery?
Yeah, there is. There's some studies that have been done, and they show that women who do hypnobirth, particularly when they're using water immersion during labour, they actually result in less instances of needing stronger painkillers, stronger medications. So definitely there is evidence to support that it's a really good pain relief method.
What about the babies? Are they calmer? Are they more relaxed with mummies?
I think because mum herself, when she's going through the process, and of course husbands tend to be a bit calmer as well, because they typically will do the course with mums. So babies that are born to hypnobirthing parents tend to be a little bit more relaxed, and I think that's probably just because of the environment that they're delivered into. And they say that actually sometimes the recovery of mums postnatally and lactation and things can be a bit of a smoother transition, because everything's been so calm and relaxed during the delivery.
Would you prefer them doing it with their partners or husbands, or does it not matter?
I mean, I think if you have the option to be able to hypnobirth and do the course as a couple, it would be really beneficial. Because also, as I said before, it's like an antenatal education program as well. So they will definitely learn all about labour and delivery and what it involves, along with the techniques. But that said, of course, if your husband doesn't want to participate in it, that's okay as well. All the techniques that you learn, you can do individually, and there's many mums that do it by themselves. So it's always an option. And I think it's really important to mention as well that even if you're not planning to have a vaginal delivery, or if you plan to have a vaginal delivery and for whatever reason a complication in pregnancy arises, any birth can actually be a hypnobirth, because the techniques that you learn, you can use them in all different sort of situations, because it's all about relaxation and staying calm and in control. So even if you have an unplanned caesarean, or a water birth, or whatever happens, you can use all the techniques that are learned, and they're really beneficial. So yeah, I'm a fan.
Win-win situation by the sounds of it.
Yeah.
Hypnobirthing is certainly part of what we offer here at our clinic. You know, if you were interested, please do reach out. We'll be more than happy to get Emma back to you to try and arrange this wonderful, wonderful technique.
Yeah, like I said, it's a month-long course, 3 hours per week. Yeah, I'll be running monthly courses. So once you reach 20 weeks, if you are interested, then we can schedule you in for an appropriate month in gestation to make sure that you have completed the course on time and you've got enough time to practice all the skills and techniques that we'll be teaching.